Unable to speak out on camera for fear of losing their jobs, some VA medical workers still want to be heard. They contacted Problem Solvers expressing a range of concerns in the midst of this coronavirus pandemic, from the number of people in their facility to how patients are screened and safety concerns for pregnant employees. One worker saying, quote, "Non-essential appointments are still coming in. There are also employees sharing offices of 6 to 8 or more in an office space. The screening forms are not adequate and no temperatures are being checked when patients come in. There's only a questionnaire form which gives patients a hall pass to come into the hospital," end quote. After a number of staff members asked what they should do if exposed to coronavirus, this email obtained by CBS 6 went out regarding asymptomatic personnel after exposure, directing them per CDC guidelines to continue working until symptoms develop. A spokesperson for the VA says they have had 0 positive COVID-19 cases and says they've relied on employees to voluntarily assist with screenings around the clock. Employees who conduct screenings or are involved in direct patient care have been given the appropriate personal protective equipment as outlined by the CDC or VA protocol. He says they've also limited visitation to only one essential family member or caregiver at a time for all patients. No visitors are allowed in the Living Center nursing homes or spinal cord injury center. VA officials also tell us they have since scaled back on those non-essential surgeries that were scheduled. They are now not being performed. They tell us as for safety measures, they will continue to adhere to the strict guidelines set forth by the CDC. Working for you in Richmond, Shelby Brown, CBS 6 News.